Birdman for Summit Healthcare is here at the Birdman Media Studios. Today I've got with me another gentleman from Summit Healthcare. How are you, sir?
I'm doing just fine, thank you.
You're Ken Allen, correct?
That's correct.
So what's your position at Summit Healthcare?
I have actually have multiple positions, but primary role is I'm chief of physician services. So I have administrative oversight for all of our employed physician offices, and a new title is the executive director of the Near Care team. And Near Care team stands for the Northeastern Arizona Regional Care Team, and that is a new physician network which combines all of the independent physicians with the employed physicians.
Okay. So you handle a lot of the contracting and stuff like that, if I got that right, or is that...
Some of the contracting, primarily oversight for physicians and the medical services physicians provide.
Okay, so sort of like a day-to-day thing for you would be, or is there?
Day-to-day thing for me is opening up new physician offices, bringing in new physicians, working on contracts to establish what types of services they're going to provide, payments that they're going to receive, working with the federal government to make sure that we're meeting all of the indicators proving that we provide evidence-based medical care. So kind of a mismatch of things.
So all the paperwork stuff, huh?
Well, paperwork and everything involved in managing a physician office.
Very cool. So are you going to be then involved with all the stuff that's going on in the new buildings? A lot of that?
Yeah, all of our physician practices. We're going to be moving 14 existing physician offices
Oh, wow.
into that building, so I'll be heavily involved with that.
And those are the ones that are scattered around and sort
They're
of
the
like
ones that
the
are scattered
locations?
all around the Pine Top Lakeside and Shoalo area. We'll still maintain clinics out in Heber, Holbrook, Snowflake, Eager, and a few other locations. But we'll still maintain an urgent care practice in downtown Shoalo and an urgent care practice up in Pine Top. But
Very cool.
everything else will be moving into the new
Everything
medical
else
office
gets moved.
building.
So talk to me about the near care team.
Sure.
That's new, as you're saying.
It's brand new, and the Near Care team is a part of Summit Healthcare's Accountable Care organization. And Accountable Care is a new direction that healthcare is going. Healthcare in the past has been a fee-for-service service for individuals.
Right.
You come in, you receive a service, you pay a fee for that. And the new direction healthcare is going is moving into what's called a value-based purchasing environment. And fee for service, you get paid for what you do. In a value-based purchasing environment, you actually preserve fees and you receive some additional add-ons based upon your demonstration that you're providing evidence-based medical care and that you're reducing the overall cost of care.
Oh, okay.
So it's actually fee preservation.
So I don't want to get into the political side of
Right.
things at all, but part of
Sure.
the Affordable Care Act caused sort of a big change in the way things were
Right.
handled as far as how people things. Previously, people had gone to the maybe doctor just when they needed to or whatever.
Right.
And then once they got on insurance, which they maybe never had been before, a lot of people just started using it all the time, which changed a lot of things, didn't it?
Right, it did. And kind of the basic tenet of value-based purchasing is population health management. And the key to that is making sure that patients receive the appropriate care at the appropriate time at the right location. So instead of patients coming in and using the emergency room for their primary care, we'd like to start shifting them more into an urgent care setting or ideally into a family practice setting where we can identify if they have any risk factors that are associated with disease. And then through our prevention or care management strategies, then provide them with the care to control those risk factors or to provide them with other services that will help improve their overall quality of life.
So talk to me for a second, because it's
Yeah.
about the first time I've ever heard somebody say that, because most people view urgent care and emergency room as the same thing. But they are different, aren't they?
Quite a bit different. Emergency services are designed specifically for that. They're designed for emergencies, and they have the most sophisticated tools and staff available to treat an emergent condition. Urgent care are those they're there for medical needs that can be provided on a walk-in basis.
Right.
More single problem, single focused types of patient presentations.
Well, let me try to give you what I sort of get that perspective
Sure.
by, because my 3-year-old thinks everything's an emergency.
Right.
She's got a cough, it's an emergency. She cuts her finger off, that's an emergency.
That's
but,
an emergency.
But urgent care is more like if
Right.
she's had this ongoing cough, we
Right.
can't get into the doctor.
Correct.
That's when you
Yeah,
get the urgent
you know, you've got an upper respiratory infection, you've got sinus infection that's been going on, you have urinary tract infection, you get, you know, maybe a dog bite or something like that, something that is an emergent. We have urgent cares available 7 days a week, like I said, in 2 locations up here in the White Mountains. And the other thing that we started to do is we started to provide walk-in services for all of our primary care offices. And again, the single purpose of that is you've got something going on, you need to get into the doctor, it's not an emergency, and so we provide those same day appointments, and then we have spillover. So if your doctor, if their schedule happens to be full for the day, then they have a advanced practice provider, nurse practitioner, or physician's assistant that are available, that are part of their team, that are available to treat you for that condition right at the time. And then if after they evaluate the condition, they feel that the doctor needs to see you, then they can immediately just bring that physician right in and you can be seen. So the whole purpose of this is to improve and ensure access to care for all of the people that live up here in the White Mountains.
Very good. Starting to sound like an Apple store. I don't know.
Yeah.
It's sort of like at levels of Genius Bar, walk-in bars. You got the appointments, things like that.
Exactly.
So it's almost like a retail experience. But that would
Right.
be kind of nice to have for
Right.
our healthcare.
Yeah.
So now the near system, and that's going to affect. Then that's other groups you're bringing into that as well.
Yeah. So the near care team is, like I said, it's a new physician network that combines the independent or non-employed physicians in the White Mountains with the employed physicians that are employed by Summit. And then the near care team is now starting to work with various insurance networks, Blue Cross Blue Shield, United Healthcare, Health Choice, Aetna, and then several large employers up here in the White Mountains that are self-insured, working with those groups. So City of Show Low, City of Pine Top Lakeside, City of Snowflake, school districts, the county, the Summit employees, and a few other large employer networks. We're now working with them on contracts to where we can come in and we can identify for them which of their employees are at risk, provide services to reduce their risk, and then also work with them to decrease their overall cost of providing health care to their employees and their dependents.
It sounds like a really good deal.
It is a good deal.
Awesome. So Ken Allen, once again, with Summit Healthcare. Any other things you want to let us know, or let any of the viewers or listeners out there know about yourself or Summit?
No, I think, as part of this this new strategy that we're moving into, you're going to see a lot more prevention services and services for individuals that are at high risk and have a lot of frequent hospitalizations or visits to their doctor's office. We're going to try and help those individuals to give them an improved quality of life. So we're real excited about this.
Very good. Hey, thank you very much for your time today. Appreciate it.
My pleasure. Thank you.
Well, once again, Ken Allen with Summit Healthcare. I'm Birdman for Summit Healthcare, is reminding you, be healthy. Hey, make sure you follow us because Angie Fabian has a 5-story office.
5 stories.
Click up there, click down there. Yeah.